Hi there, it's Dr. Megan from Balance Within PT. I want to show you today a nice little self-release you can do if you're having hip pain, low back pain, sciatica type pain that's going down your leg, just any pain in this kind of buttock area. So it's going to be using a ball, and there's a few different ball options. You can use one of our myofascial release squishy balls. That's a nice place to start. You can also use a tennis ball, or if you feel like you need a little bit more, you can even use a lacrosse ball, which is a little harder, but I recommend starting with a softball first. So what you're going to be doing is using this ball to help release tight tissue. So oftentimes, for various reasons, you can have those muscles that guard and constrict, and they can put pressure on the nerve, they can torque your pelvis, and they can cause some pain. So using the ball and pressure to get them to slowly start to soften. So you're going to put the ball under the side of your butt cheek and kind of shifting around. You're going to wait until you feel for a spot that feels a little tight, a little achy, a little uncomfortable, a little sore, not sharp shooting pain, but where you're feeling that kind of hurts good, tight sort of feeling. So you want to sink into that feeling. And what you'll feel is it might take 30 seconds, it might take a couple minutes, but you should feel it slowly start to soften and ease up a little bit. That tension should be relieving feeling. It should feel like a good release with that. So you can stand there, like I said, it might take 30 seconds, it might take a couple minutes. As you feel it start to release, shift off that area and see if you can find another place and sink into that spot. So depending on the amount of time you have, you might be able to spend just a little bit of time in one or two areas, or you might be able to tackle a few different spots and then maybe the next day check out and see if there's other tight areas. If this is not a comfortable position, you can also try this standing up against a wall. So you put your ball, you'd be standing, you put your ball against the wall, and then you kind of back yourself into it so that your butt cheek is touching that ball, and that can be a nice way to get it to soften and release too. One caution is the sciatic nerve goes right through your cheek there, so if you're feeling tingling, numbness, or like a sharp zinger pain down your leg, go ahead and shift off that a little bit because that's going to irritate that nerve. So I recommend starting more on the side of your hip and kind of working your way in and avoiding that direct midline area. So I'd love you to give this a try and let us know what you think, and hopefully it'll help ease a little bit of tension in that area for you.